Hi friends, you are preparing hard for the NEET PG exam which is on March 5, 2023. Oncology is a very important topic for the NEET PG exam and at least 30 questions will be from the oncology part out of the 200 questions. Different subjects oncology will be covered. So let us begin immediately. Cancer genetics. If you know about the cancer genetics, type yes in the comment box. Then cancer cell biology. Know everything about the cancer cell biology. If you know it, then type yes in the comment box. Then principles of the cancer treatment, the different principles: chemotherapy, radiotherapy, then chemo radiotherapy, then surgery, the surgical staging of the cancer, then the surgical treatment of the cancer, different modalities of treatment, then palliative treatment. All these treatments you must know, and once you learn it, you type yes in the chat box. Then infections in patients with cancer. So the special types of infections, for example, the different bacterial infections, the fungal infections. In cancer patient, the immunity is suppressed, so there are more chances of fungal infections, bacterial infections, complicated infections, drug resistant infections can occur in patients with cancer. Then oncological emergencies, the different oncological emergencies. Remember, the patient does not die with cancer. He dies of some secondary infection or some complications that arises, the oncological emergencies, which are very important. Know everything about the oncological emergencies. Now coming to the hematological oncologies. So in hematological oncologies, we must know everything about the myeloid leukemias, the acute myeloid leukemia, the AML classification systems, the WHO classification, then the French, American, British classification. So the different classifications, then the incidence and etiology of the acute myeloid leukemia, the clinical and laboratory features of the acute myeloid leukemia, and finally the treatment of the acute myeloid leukemia. Then again the CML is most important, and the chromosomes which are involved in the Philadelphia chromosome in chronic myeloid leukemia, the clinical and laboratory features of the chronic myeloid leukemia, the natural history of chronic myeloid leukemia, the different crises, the blast crisis of the chronic myeloid leukemia, then the response criteria in the chronic myeloid leukemia, then how there is a complete response, incomplete response, then the treatment of the chronic myeloid leukemia, in entirely everything about the treatment of the chronic myeloid leukemia. This chronic myeloid leukemia will definitely come into the NEET PG 2023. So this one topic you must not miss. Then coming to myelodysplastic syndromes, very important, and it is important for the INICT also as well as for the NEET PG exam. Myelodysplastic syndromes, the MDS, the incidence and etiology of the myelodysplastic syndrome, and especially the chromosomes which are involved in the myelodysplastic syndrome, the clinical and laboratory features, and the treatment of myelodysplastic syndrome. The different myelodysplastic syndrome, WHO classification of the myelodysplastic syndrome. Then the myeloproliferative syndromes, then JAK2 kinase mutation, then the polycythemia vera, then idiopathic myelofibrosis, then other lymphoid malignancies, the classification of the lymphoid malignancies, then clinical scheme of the lymphoid neoplasms, the different chronic lymphoid leukemia, the indolent lymphoma, the aggressive lymphoma, that is diffuse large cell lymphoma. Repeatedly, last 5 years, 10 years, it has been asked, diffuse large cell lymphoma, then acute lymphoid leukemia, the lymphoma, then plasma cells disorders. Plasma cells disorders, the most important is the monoclonal gammopathy of uncertain significance, MGUS. Then solitary plasmacytoma, extramedullary plasmacytoma, multiple myeloma, and plasma cell leukemia. Then Hodgkin's lymphoma, then chronic lymphoid leukemia, the chronic lymphocytic leukemia, that is CLL, very important, the treatment of chronic lymphocyte leukemia. Then follicular lymphoma, then the different aggressive lymphomas, then acute lymphoid leukemias. All these lymphoid malignancies are important. Then plasma cell disorders, including the multiple myeloma, very important. Then Hodgkin's lymphoma, non-Hodgkin lymphoma. All these topics are absolutely important. If you know these topics, then type yes in the chat box. Now coming to the cancer of skin, a very important topic in dermatology. as well as in pathology and as well as in medicine. It can be asked a cancer of skin, the different skin cancers, the malignant melanoma, the incidence of the malignant melanoma, the factors associated with the increased risk of malignant melanoma, the predisposing factors, for example, fair complexion, sun exposure, family history of melanoma, dysplastic nevus syndrome, then autosomal dominant disorders, then the different chromosomal syndromes associated with the malignant melanoma, the different types of malignant melanoma, that is superficial spreading, lentigo malignant melanoma, acral lentiginous, and nodular. Then the biology of the malignant melanoma, the prognosis and the treatment of the malignant melanoma. Then basal cell carcinoma, very important part, repeatedly asked topic. It is basal cell carcinoma, the predisposing factors, the different types of basal cell carcinoma, the clinical appearance of basal cell carcinoma, and how do you treat the basal cell carcinoma. Then squamous cell carcinoma of the skin. Then coming to head and neck cancer, the very important part in the ENT part, ENT malignancies, head and neck cancer, especially the nasopharyngeal cancer. Nasopharyngeal cancer is the most important part in the ENT part, head and neck cancer, the different categories of the head and neck cancer, how do you treat the head and neck cancers. Then the lung cancer. In the lung cancer, the different neoplasms of the lung, the histologic classification of the lung cancer, the staging of the lung cancer, the different genetic mutations, the driver mutations in the adenocarcinoma of the lung, then the lung treatment of lung cancer, stage-wise treatment, then the non-small cell lung cancer, small cell lung cancer, then bronchoalveolar adenocarcinoma with EGFR receptor mutation and ALK rearrangements. Then summary of treatment with the patient's treatment with lung cancer. Then the screening, how do you screen about the lung cancer, how can you screen it, the different predisposing factors for the lung cancer. These are the different things. Then the breast cancer. In the breast cancer, the genetic mutations in the breast cancer, the diagnosis of the breast cancer, how do you palpate the breast, then the different clinical staging and the molecular staging of the breast cancer, how do you stage, then the stage-wise treatment of the breast cancer, then the inflammatory breast cancer, then male breast cancer, this can be asked. Then coming to the gastrointestinal system, the upper GI tract cancer, the lower GI tract cancer. In the upper GI tract cancer, the esophageal carcinoma, the pathology of the esophageal carcinoma, the adenocarcinoma, the squamous cell carcinoma, then the major risk factor for the esophageal carcinoma, the clinical features of the esophageal carcinoma, for example, progressive dysphagia, then the diagnosis of esophageal carcinoma and the treatment of esophageal carcinoma. Then coming down, the gastric carcinoma, very, very important, repeatedly asked gastric carcinoma, the risk factors associated with the gastric carcinoma, that is a smoked food, all those things, the nitrate, heavily salted foods, then the genetic cancer, then the Helicobacter pylori infection, very important, then Meniere's disease, then increased incidence of gastric carcinoma in blood group A. Then coming to the pathology of the gastric carcinoma, the clinical features of the gastric carcinoma and the diagnosis, how do you diagnose, then the treatment of the gastric carcinoma, stage-wise treatment, then benign gastric tumors, the different benign gastric tumors, the adenomas, hamartomas, leiomas, which are quite rare, then the benign gastric tumors, how do you remove the benign gastric tumors, then the small bowel tumors, then coming to the treatment, the diagnosis of the small bowel tumors, then the colonic polyps. Polyps are very important. In polyps, the tubular adenoma, the villus adenoma, the hyperplastic polyps, which can turn into malignancy, which cannot turn into malignancy. Then the hereditary autosomal dominant gastrointestinal polyposis syndrome, which include the familial polyposis coli, Gardner syndrome, Turcot syndrome, non-polyposis syndrome, juvenile polyposis, and Peutz-Jeghers syndrome, repeatedly asked. In the colorectal cancer, the risk factor for the colorectal cancer, the pathology of the colorectal cancer, the clinical features of the colorectal cancer, the left-sided, the right-sided, then the treatment of the colorectal cancer. This is the very important part. Then the tumors of the liver and the biliary tract, including the gallbladder carcinoma, the hepatocellular carcinoma, including the benign liver tumors, the hepatocellular adenoma, which has been repeated as, then the pancreatic cancer, the mutations that occur which lead to the pancreatic cancer, then the treatment of the pancreatic cancer, then the carcinoid tumor, then the pancreatic islet cell tumors, then the neuroendocrine tumors, then especially the pheochromocytoma, insulinoma, gastrinoma, VIPoma, pheochromocytoma, somatostatinoma. These are all the different types of gastrointestinal endocrine tumor syndromes, the carcinoid syndrome, Jollinger-Ellis syndrome, gastrinoma, insulinoma, VIPoma, then glucagonoma, somatostatinoma, then the pancreatic cancer, then the neuroendocrine tumors of the gastrointestinal tract and the pancreas. Coming to the genitourinary cancers, the bladder cancer, the renal cell bladder cancer, the clinical presentation of the bladder cancer, the etiology of the bladder cancer. For example, what happens in the bladder cancer? The deletion in 17p, that is p53, then 13q-rb, then 3p and 5q, invasive lesions, then overexpression of the epidermal growth factor, then HER2 new receptors, whatever all those things that happen that we have to study, that is very important. Then coming to the pathology and clinical presentation of the bladder cancer, the treatment of the bladder cancer, how do you manage? Then coming to the renal cell carcinoma, the incidence and epidemiology of the renal cell carcinoma, very important tumor it is, renal cell carcinoma, the etiology of the renal cell carcinoma, the pathology, the clinical presentation of the renal cell carcinoma, and the treatment of the renal cell carcinoma, how the different modalities of treatment. Then coming to the testicular cancer, the incidence of the testicular cancer, the etiology of the testicular cancer, the pathology, the clinical presentation, then the stage-wise treatment of the testicular cancer, how do you do the treatment. Then the prostate cancer, benign and malignant, benign prostatic hyperplasia, then the malignant disease of the prostate, different prostatic carcinomas, the treatment of prostatic carcinoma, the stages of the prostatic carcinoma. Prostatic carcinoma is a very important in the genitourinary surgery. Then coming to the testicular cancer, the renal cell carcinoma, carcinoma of the bladder and the urinary tract, benign and malignant disease of the prostate, the testicular cancer. You must thoroughly know everything about these things. Now coming to the gynecological malignancies, the gynecological malignancies form an important part of the gynecology. The most often asked, at least 1 or 2 questions on cervical carcinoma, 1 or 2 questions on the endometrial carcinoma, and 1 question in the ovarian cancer. Total 5 questions on the gynecological malignancy will definitely come in the NEETPG exam. So the ovarian cancer, the incidence and epidemiology of the ovarian cancer, the genetics of the ovarian cancer, the screening, the clinical presentation, the pathology, the staging of the ovarian cancer, the stage-wise treatment of the ovarian cancer. Then coming to the endometrial cancer, the clinical presentation, the pathology of the endometrial cancer, the pre-malignant conditions, then the staging of the endometrial cancer, then hysterectomy, everything about the hysterectomy, total hysterectomy, all those things, then the treatment of endometrial cancer, then cervical cancer. In cervical cancer, the screening of the cervical cancer, the HPV vaccines, very important, the different types of HPV which cause the cancers in cervical cancer, then the HPV vaccine, when it is given, the dose, all those things that are very important. Then the cervical cancer staging, then the stage-wise treatment, then the palliative treatment in cervical cancer, then prostate hyperplasia and carcinoma, prostate hyperplasia, prostate carcinoma, then prostate cancer prevention, then coming to the primary and metastatic tumors of the nervous tissue and the soft tissues and bone sarcoma is very, very important, especially in the orthopedic part, that osteogenic sarcoma, the different types of bone tumors including the osteochondroma, the malignant bone tumors are very, very important in the orthopedics. The tumor question part will come, at least 2 questions will be on the bone tumors in the orthopedics, and in gynecology 5 questions will be from the gynecological malignancies itself. Now coming to the different bone metastasis, the vertebral metastasis, the various bone metastasis, then the clinical presentation of the bone metastasis, how they present. Sometimes the patient may present just with the bone metastasis. Then we have to find out from where this metastasis has come. Then the carcinoma of unknown primary site, a very important topic, carcinoma of unknown primary site. Possible you have to take the biopsy and try to find out from where this carcinoma has originated. Then you will do the immunohistology, the different hormones for the different the desmin, for example, desmin for sarcoma, HMB45 for melanoma, then CEA for carcinoma, cytokeratin for the carcinoma, LEU-M1 for Hodgkin's disease. These are the immunohistological map. And then the flow cytometry, for example, B cell marker, T cell marker for the lymphoid neoplasm, then the ultrastructure, then the cytogenetics. Cytogenetics is a very important topic. Cytogenetics can be asked even in hematology, oncology, and all the cancers. You must know the cytogenetics and genetics of every cancer, every possible cancer you can know about. If you want to know it in detail, you can type in the link below you will get more videos. You join the WhatsApp community in the link below, you will get more free videos and more different PDFs, and which will help you in the preparation in your NEETPG exam and the next exam. Then coming to the paraneoplastic syndrome. So paraneoplastic syndrome is a very important topic, the endocrinological paraneoplastic syndrome and the hematological paraneoplastic syndrome. What happens in the paraneoplastic syndrome? There is a ectopic hormone production is there. So hypercalcemia, malignancy, SIADH, then Cushing syndrome, non-islet cell hypoglycemia, male feminization, diarrhea or intestinal hypermotility, then oncogenic osteomalacia, acromegaly can occur in the paraneoplastic endocrine syndromes.